So I think we're all ready. Just welcome everybody. I'm Tasha. I actually recognize a lot of faces here, so that's great. This month is Mental Health Month. So there's always things. I think the last time that I was here, I just talked about a lot of different types of mental health, different diagnoses. And today I'm actually going to focus a little bit on addiction, because addiction goes with mental health. It's pretty much hand in hand, and a lot of people don't realize how much mental health is behind addiction. A lot of the things in the state are changing legal-wise, restructuring and stuff like that, and they're starting to recognize that addiction and mental health are a co-occurring thing. So, and now just also share, addiction is not textbook. That is one of the biggest things. So just because I share something a certain way does not mean that this may not have been an experience for another person. So, okay, here we go. So mental health, of course, is out there. 1 in 5 suffer from some type of mental health. I don't know if you want to call it suffer, but have some type of a mental health diagnosis. Over 46 million people, 12 and older, which I think is kind of sad, has had some type of a substance use disorder. And substance use would include alcohol, drugs, nicotine. It's a substance. And then over 9 million Americans have co-occurring diagnoses with both the mental health and the substance use. So, addiction. I wish addiction was something super simple to explain to people, but it seems like it could be, but it's not. You have to understand that addiction is a disorder, such as like hypertension or diabetes. There are things that you have to do in order to overcome it or work with it. And for people who may not have to deal with addiction, it can be kind of hard for us to understand that and explain it to other people. So it's chronic and it's relapsing. So when people are sober for so long, that's why it is a big deal to celebrate that with them, because they need that reinforcement. Most of the time they're compulsive, they're doing harmful things, they don't care what the consequences are. A lot of them, they don't care if they go to jail, they don't care if they're arrested. Some people do it so they have that, so they have food. So it's like, it messes with a lot of things. It changes the brain structure. The biggest thing is the reward and the self-control. That is a normal pathway for all of us, like, oh, you did this, good job, yay, so we want to repeat that behavior. And addiction changes that. Substances, most of them illegal, change that chemistry. Common substances is alcohol. That was probably the most common. Drugs, and we're not just talking methamphetamine or cocaine or anything like that, but opioids. We all know that that has been a huge thing, is the opioid epidemic, and how many people have actually suffered from problems because of that, because we were prescribing it like it was Tylenol, essentially. And then there's cannabis, so that can be a heated topic, but because we have surrounding states in our own state that there are certain purposes that we do allow it, it's still a problem. And nicotine, of course, nicotine is legal, but it's still an addiction. And then the behavioral things. So there are things that don't necessarily include the substance, so gambling, internet, pornography, food, those types of things also do the same thing for the structure in our brain. The biggest thing is that addiction is not just about substances. Anything that stimulates our brain's reward system and leads to a compulsive, harmful behavior can become an addiction. Many addictions co-occur with mental health, making treatment more complex, but also more essential. So when we're treating people with substance use, we have to understand that they might have a depression or a bipolar diagnosis with it, because they probably were using a substance to medicate their mental health disorder. So this is a little nerdy. But this is the dopamine pathway. So the simple thing is, this is what tells us that, oh, this was good, or this was bad. So it messes with the mesolimbic pathway, which is our reward circuit. And then, when we use something addictive, it stimulates the dopamine. Dopamine is our feel-good. Yay, we like dopamine. And it causes happiness and euphoria. Well, what happens when it comes to substances is that it falsely elevates it, maybe is the word I want to use. It makes it so it is way out of league. So a normal response for a person when we do something good is, yes, this is happy. Oh, I ate this food and it tasted good, now I'm full. Yay. Or a runner's high. I ran, I felt good. Good, I'm going to continue to do it. Those are healthy things. However, when we use illegal substances, it amplifies that reward. And then we continue to do it because we can't get that same effect every single time, if that makes sense. So then we get tolerance, which is then why we have people who overdose, and then we get dependence, which is why we get people who will end up in treatment 4, 5, 6, 7 times and don't know where to go. So when those things are happening, the other part is our natural rewards become less important. So, which is why like people stop caring if they're taking a shower, why they stop caring if they go to work, because they're not getting joy out of that. They don't care if they're interacting with their friends, unless their friends are the ones who are getting them the things, but they just, our normal goes way down. So with repeated exposure, we continue to inhibit the dopamine, and we can't, it's more difficult for us to keep a balance. It leads to tolerance, it leads to dependence, and then we start having different controls and different cravings. Also, so there's other little different things that addiction disrupts our prefrontal cortex, which is our decision and impulse. So a lot of the times, some people will say, with brain injuries, I'll use this as an example, is that when we hit or hurt the front of it, our impulses aren't good anymore. We make bad choices, essentially. But then addiction affects that, as well as our stress and our response. So which then causes problems with control. We have cravings. It's like, I keep on thinking of psychology class with Pavlov and the dog and the food and the tongue waters and type of a thing. That's essentially what this all does. But then when it gets to be too bad, and the stress that maybe caused them to start using in the first time, then they don't know what to do. They easily will go back to, well, this is how I dealt with it, so that's how I'm going to continue to do with it. Addiction does not happen overnight. Addiction has a lot of co-occurring things. So we don't just wake up and decide that, oh, I'm going to like alcohol a lot today, and I'm just going to do it and whatever. There are genetic predispositions. Alcoholism is one of the big ones that people really can tell when there is a genetic component. Typically, it always goes first generation, and after you get about 3 generations removed from the one, we start to see an improvement. But yeah, if you have a parent who's an alcoholic and that's what you grew up with, chances are you're going to be alcoholic, unless you have different influences going on in your life. Addiction is viewed as chronic, it's relapsing, and it's not just a series of bad choices. The brain changes persist long after use stops. So it's just because I stop today doesn't mean that tomorrow I'm all of a sudden going to make all the right choices. That it doesn't happen that way. Which is why people end up going to treatment so many times. A really good way is addiction is a hijacked brain, essentially. It rewires our brain reward, stress, and self-regulation systems, leading to compulsive behavior, tolerance, withdrawal, and relapse, despite those negative consequences. So I'm going to step a little bit aside, and I feel that it's important for people to know that this is much more common than we think that it is. In our community, we know that addiction is out there. We know that what can we do to help this person? What do we need to get them to the hospital? Do we need to give them food? What are these things that we need to do? And, or is it, well, they should just stop type of a thing. But it starts way, way, way before we see them walking around the streets. So a patient of mine who has given me permission to discuss this, grew up in a family where there was alcoholism on both sides of the family, mom's side and dad's side. Dad's side went back, I think, 3 generations, and mom's, I think, went back only about 2 generations. Did very well in school, for the most part. He would say that he had a decent upbringing. He was a good athlete, actually had scholarships for college. Decided to join the military. Wonderful, great. Well, I'm biased to that, but so joined the military and was very active and like jumped out of helicopters, those types of things, and ended up injuring his knee. So now this person is 60. So about this time is when opioids are starting to get prescribed quite a bit. And he flat out said, I hurt my knee, the military gave me those pain meds, and I never stopped. He doesn't blame the military for it. And he says, I should have known at that point that I should be doing something different just because of my family history. So while he was in the military, besides the knee, then he also had a horrible traumatic event with PTSD to the point of like can't wear a CPAP because he's so claustrophobic. After he came back from the military, he still continued to have problems with his knee, continued to get medicated, started working for a company, and then was introduced to drugs. Well, the opioids weren't doing it, so now we're going to start doing something different. And the alcohol was combined with it. During this time, he was so involved with his addiction. He lost his wife, he lost his children, he ended up actually being quite involved with the cartel and just didn't know where to go. Happy to say now, he is 12 years sober. He is very proud of his sobriety. He talks about it very well, but he will be the first one to tell you, I went to treatment 9 times and it wasn't even that 9th time that I became sober. He says, and I believe this because I have a lot of patients that kind of explain it, they get to a point where being here is worse than getting better. So they're going to choose to get better. He said part of his why is that. The other part of it is his granddaughter, and that has been a huge focus for him. He also says that his faith. I find a lot of people who end up, I'm going to be sober and I'm going to do this, I'm going to work through it, I'm going to get it. They either have found God or they have understood their faith. I'm not saying that that's an end-all be-all, but it's in my experience. So that's just one person that I've seen that has addiction. I see addiction, I think, with half of my patients every day. And everybody's addiction is a little bit different, whether it's a substance or whether it's food or shopping or anything like that. So understanding kind of where that comes from helps. Signs that people may be struggling. Being secret or evasive. Now this is quite, in my head, yes, this makes sense. So people will go to great lengths to hide what they're doing. Just come up with some of the most bizarre stories and thinking that they are fooling you. They will just avoid answering questions or just avoid you in general. They lie, and they'll lie to you when they're having just a normal conversation about it, and it'll seem like it's second nature. You may know the truth, but they think that you don't, so they're just going to lie to you about it. Mood swings. A lot of people who have any type of a substance use disorder has huge mood swings. One minute we're happy-go-lucky, and then the next minute we are not, and we're angry, we're mad, we're aggressive, anything along those lines. People have a different personality, I guess is a good way to put it. Completely different personality. There is changes in sleep. So some drugs obviously affect people's sleep and wake cycles. So sometimes they're not sleeping at all. Sometimes they're sleeping all the time. Sometimes they're sleeping at odd times. It just kind of depends on what they're using. But again, they don't think that it's really that big of a deal because they still have the energy to do something later. Weight. Weight has a big thing to do with it. Matthew Perry, I don't know how many of you guys read his book. He was very honest about his addiction that he went through, and you can tell, and he says this in his book, that when he was having an issue with his pain medications versus his alcohol, because his weight fluctuated. When it was the alcohol, he was much heavier, and when he was using pain medications, he was much thinner. I'm a huge Friends fan, so that is something that I was able to pick up on really, really quickly, because I know that between 2 seasons, there was a huge, huge change in his size. So, and now I look at it, I'm like, oh, I feel bad that he suffered through all of that. Attitude, appearances, they change the way they dress, they hide stuff, they wear big clothes, they don't care what they look like. They don't care really about much of anything. There's not a whole lot of joy. The only thing that they care about is their next high, and they don't care who they hurt while they're trying to get there. They can't hold a job. They don't meet obligations, so that's another thing that people will start to struggle with. Okay, we're going to start this project, but we're not going to finish it. They can't get up in the morning to go to work because they need to make sure that they got high before they left. Memory issues. Substance abuse can really affect our memory. Long term, like with alcohol, a lot of people start to have dementia. A lot of the times people in their drug use years, there's parts that they remember. It's typically the more intense things, but they won't remember if they said something horrible to somebody because it didn't matter at that time. Stealing, they steal a lot, and from a lot of people and from a lot of places. Again, they don't care if they get arrested because they just need that money. These are things to look for. If you recognize it with people, talking to them, bringing it up, they will probably be evasive. They'll probably tell you that you're crazy and that you're just thinking into things, but making them aware that you are aware that something isn't right is important. So we encourage them to get help. You have to be prepared for the conversation because it will be very defensive. That person will tell you, no, I'm fine, it's just a drink, or I only do it on the weekends, or something along those lines. You want to, instead of saying you have an issue, you are doing this, you are doing that, using the I feel like this, because then it doesn't seem like you're attacking them, because that's what they'll say, you're attacking them. And then trying to explain how it's impacting other people, and not necessarily that person, again, just screwing up. And the other thing is to take care of ourselves. When we deal with family members or friends that have addiction, it will take a toll on you. There are a lot of things that you will test yourself on, your own patience, your own morals and rules, because as people, naturally, we want to help. We want to care for these people, and we have to put up some pretty hard boundaries with these people that can look mean to the outside world. No, they can't stay here, because if I give them a place to sleep, they'll always come back here. No, I'm not going to give them more food, because this is just going to continue to happen. It's a cycle. The boundaries. It's everybody that has issues with boundaries. It's not just a parent, it's a sibling, it's a friend, it's everybody, because when you have a person who has addiction, we ourselves don't see it all. Another person might see something different, and be like, oh yeah, no, I don't think it's actually that bad. I don't really care. But there's always enablers when it comes to addiction. Be supportive. Be supportive to the addict, of course. Congratulate them, be excited with them. Let them know that you care about them regardless. Show support by going to appointments, those types of things. And just know that addiction is not a short game. This is totally a long game. People who have had addictions for years will say that every day. Every day is a choice. I wake up and I have to choose to not use. Many disorders that go with it are depression, anxiety, bipolar, PTSD, and schizophrenia. People tend to start using those or tend to have these diagnoses because they don't know what else to do. Well, it's because there's barriers to treatment. There's lack of access. We all know that access to mental health is quite difficult. So we have to try to be present in many different situations for people. A lot of the times things are underdiagnosed, especially in our minority populations. One thing mental health providers have to be aware of is there are many cultures that certain behaviors are not viewed as bad, but we view them as bad. So it's also understanding those types of things. Dual diagnoses complicates things. So anybody who works in the hospital and has to go place somebody at a treatment center or even just to a hospital, when we have dual diagnoses, it's like, okay, now we're sitting ducks and we're just waiting, because there are places it's like, no, we're not gonna do that, we're not gonna do that. We'll do this, but we won't look at that. Risk factors are a huge thing, so trauma, genetics, brain chemistry. So trauma is something that is quite interesting because two people can experience the same thing and have two completely different responses to it. So understanding that just because this person was involved in a car accident and dealt with it and went on with her life does not mean that the next person is going to have that. And a lot of it has to deal with their genetics and their background. Integrated treatments. So mental health is not, here's a pill. Mental health is not, here, let's sit and talk about this. It is so many different steps. It's the people that are around the addict, and it's the people that the addict sees. So yeah, in some cases it is medication because we need to treat those mental health disorders. And then the other part is the therapy component, because there is substance use therapy. Some of these people end up having to do like a family therapy. Some of them, it's just individual therapy. There's all sorts of different things. And these people are relearning all of those behaviors and all of those relationships. Mental health has a huge, huge cost. There's over $1 trillion that's lost in productivity and healthcare and justice expenses, which I see that, and yes, it makes sense. The amount of money that is spent on a person to help them become clean is unbelievable. And then it is disheartening when they relapse. But understanding that they're going to relapse helps. This is also why we have homelessness, incarceration, and family problems. Yes, there are people who get arrested because they need a place to sleep. They need food in those situations, which is sad. So what's being done? There are things that are changing. So we have expanded Medicaid coverage for behavioral health, which is great, because some of our insurances that have been not great for reimbursement or even just finding people. There's increased use of telehealth and teletherapy. Now these are all preferences to people on which you prefer, but the ability to see somebody who is 100 miles away and doesn't have to drive is huge. Some of the stuff is like Noxalone for overdoses that we give people so they live. Needle exchanges, so I know that there's a lot of states, California is a big one, where they have areas for people to go use where it's clean and where it's safe. Now, we all can have our opinion on that. And public awareness is a huge thing, and just understanding just like just plain mental health, that substance use and addiction also needs to be destigmatized. I can about imagine the number of people who probably have a family member who has had an addiction, or a friend who's had an addiction. Moving forward, of course, we're going to support and advocate for mental health because it's huge, it's important for our communities, it's important for our families. Promote early intervention and access. So one of those first statistics had showed that the age of 12 was a beginning point, and it's true. There are some people that it starts even sooner, and when you grow up with it and that's all you see, that addiction starts even sooner, and it just becomes a learned behavior, like, oh, I'm gonna go to bed at 10 o'clock type of a thing. And be compassionate and understanding around addiction and mental health, and if you don't know what to do, to find somebody to ask about it. So with trying to make sure that we continue to support our mental health and expand mental health, one thing that we're doing here locally is we have added another psychiatric nurse practitioner. Her name is Anne. She comes to us from Sioux Falls. I'm very excited. She was a student with me in the fall semester of, I guess, suppose it would be the school year. So now she will be starting to see patients. I'll let her just.
Perfect. Hi, everyone. My name is Ann Conda, as she said. I live in Sioux Falls with my husband and my son, and we have a girl on the way. I had the pleasure of working with Tasha and Keisha at the clinic for 300 hours last fall, and I absolutely fell in love with everything they're doing for the community and helping underserved populations, and was thrilled when I was offered a job here. So I graduated from Mount Marty and have already started rolling and going to be helping Tasha out, and excited to be here. So thank you.
Any questions? I don't know if people have questions. Seems like, Amanda, do you have a question? So we have Amanda with us too. She's one of our therapists in the building with us, and she actually has her substance use certification thingamajig. So she sees a lot of people who have that. So we're very thankful for that. Yes.
What age group do you see?
Me, the whole age group. We see kids to geriatrics. So, like we were at the nursing home earlier today, seeing people. I go to the school, and I see people at the school locally. So, our mental health program, I feel, is really trying to access as many people, because some of the barriers with kids is somebody's got to bring them to us, and instead of missing like 2 hours of school, if I just go there, I have a place, I see them there, and they can just go to it and then go back to class. I think that that's one of the most wonderful things that we have been able to do.
I'm curious about children in therapy. So do you share with your parents, or can you not share with them? How does that work when you have a minor child?
Right, so, I don't know how well this is listening here. So her question was about minors and what they share when they come to visits. So, in the medical world, there are certain things we have to share, but for the most part, no. Unless the patient or the child is a harm to themselves or others, or they're being harmed, it's pretty much what you tell me stays with me. And establishing that with not only just the kids that we see, but even the adults that we see as soon as possible is essential, because they, trust me, they start to get weirded out that you're calling people and telling people about all sorts of stuff, so.
Are there just the two of you servicing Osceola County, or?
So both Ann and I are certified for psychiatric, so we do a lot of medication prescribing, we do some psychotherapy. We have Amanda who has her office with us at Interconnections, and she does therapy. So she is just as full as we are. We do a lot of networking back and forth, we do a lot of collaboration, and then, yeah, there's a lot of times that we just have to call other places because the availability isn't there for either one of us. So that's why we're super excited to have Ann, so. And I know that Amanda continues to, she's wanting to expand as well, so if you have somebody,
Yes. Bring them on.
please send them to Amanda.